Hello, sir. I'm
Hello.
Dr. Ritchie. I'm one of the ward doctors. I understand you've asked to have a bit of a chat with me and find out what's going on.
Well, yes, because I've had these various tests and, finding out what's happening,
Okay.
because, as I say, it's been a bit worrying.
I can imagine. Before we get into that, can I just double check that I'm talking to the right person? Can I just check your name,
George
sir?
Vass.
George?
Yes.
And what would you like me to address you as?
Whatever you like, really. George is fine.
Okay,
People at
George.
work call me George.
Fine. And can I just check your date of birth as well?
Yes, I'm 30.
Okay, fine. And have you got any friends or family with you today that you want to
No,
involve in the discussion?
no.
Okay.
No.
So please let me know, how can I help you?
Well, I was just hoping you might have some, test results. They've done a scan and thing, and they've been taking fluid or something off my spine, which all seems a bit dramatic. But in fact, my GP seems to think I might well have meningitis.
Okay.
I don't know whether I have or not, but and again, there's where I work in an office, and there's been swine flu going around. Well, it's an exaggeration. One person got swine flu a few days,
Okay.
a few days ago, and it's all been treated. But I don't know whether. I suppose it does pass from person to person, and I've been feverish and feeling ill. That's why I went to the GP. So I was wondering whether it might be that.
Okay. So you've been feeling ill for a couple of days, feverish.
Yeah.
Generally, just sort of not right.
I still feel feverish, actually. I mean, I've got my antibiotics and things, but I still feel, not quite as bad as I did, but not right yet.
Yeah. And any other symptoms? I understand you had a rash.
Yes.
Okay. And was there anything else?
No.
Okay. And one colleague in the office, you said, has been treated for swine flu.
Yes. Not somebody I'm in close contact with, but you never know. You pass people in corridors and, canteen queues and things, don't you?
Yeah.
They had some Tamiflu or something, I believe the word was, that they were supposed to be getting.
Sure. Okay. So as you've alluded to, you've had a whole number of tests.
Yeah.
Because I mean, it was quite clear when you came in that you had a fever and you had markers of infection. So we wanted to find out where that was coming from. Lots of the standard tests that we do, looking at your chest x-ray to see if there's a lung infection, have all been normal,
Right.
which is why people have moved on towards doing these more complicated tests that involved a head scan,
Yes.
which again was normal.
Right.
And then, as you said, they took a little bit of fluid from around your spine.
Yeah.
So that's looking for any infection in that area.
Right.
And doing that has allowed us to identify the source of infection, which is in that fluid.
So I have caught something.
You have an infection, absolutely, and you've caught
Yeah.
it from somewhere, but I think importantly, you've not caught it from your friend in the office. What you have is
Right.
what we would call meningitis.
So the GP's right.
The GP has got it absolutely spot on,
Right.
and they've done quite the right thing sending
That's
you.
what she said, actually. She thought it was meningitis, and I was sort of a bit confused then, because I thought, well, neither of those, swine flu or meningitis, sound particularly good news, do they? But it's definitely meningitis then.
Absolutely. And we've got you on the right treatment for
yeah.
that.
So where do we go with that then?
Okay. So if we just try and structure the conversation a little bit, just so I make sure that I cover everything. We've discussed the diagnosis, and again, meningitis, it could be seen as a bit of jargon. Are you happy with the explanation that this is an infection in the fluid that's around the spine and the brain?
Well, fine.
Is
No,
that-
I have no idea where. I know it is quite serious, and they get all very excited with, particularly with children, don't they? I mean, is it better being in an adult, or is it worse?
I think the most important thing is the timing of treatment, and you have presented to your GP when you started to feel unwell. This has been identified before you've become very sick with it, and you're on the right treatment.
Okay.
So I think that's the most important point, is the timing and the fact that you're now on the right treatment,
Yeah.
and you will improve with that.
So it will improve. It's not any. I mean, people do get excited about it. It does sort of, being quite a serious. I mean, it is a fairly serious condition, isn't it?
Absolutely, and I want you to stay in hospital. I'm very glad you are in hospital.
Yes.
To have it treated.
That's fine. No, I want to get better. as long as it takes. So what will the treatment be then?
Well, the treatment is antibiotics.
Right, okay.
So you're going to be on intravenous antibiotics,
Yeah,
so
it's like
through a drip,
yes,
as you are
now,
now.
at the moment, yeah.
For probably a fairly prolonged period.
Mm-hmm.
Now, this is quite straightforward. Once
Yeah.
you've got that cannula in, we can give you the treatment
Yes.
without any worries. Any side effects of the antibiotics, we've got to think about, because we want to balance benefit and any side effects.
Can there be side effects? I didn't realise you could have side effects from antibiotics.
Well, you can have side effects from almost any
I
drug.
suppose, yeah.
And the side effects of antibiotics can be very variable.
Right.
Some people are allergic to certain antibiotics.
Yeah.
However,
Yeah.
that would have presented pretty much after the first dose. So if
No,
you're going to have a
I've not
very...
noticed anything, yeah.
And that's great. So any bad reaction, we're fairly sure that's not going to happen.
Okay.
And I think what we now need to think about is the more minor side effects of antibiotics, in that they can cause people to have stomach upsets. You can develop loose stool. You can sometimes go off your food a little bit
Yeah,
with
well,
them.
yeah. Yeah, well, that's not too bad, is it? So that's not anything too serious. Provided the antibiotics are getting me better. I mean, that's a small price to pay, isn't it?
I think absolutely.
Yeah.
The final thing that we need to think about in terms of treatment side effects is that because you're going to be on some very strong antibiotics, potentially for a prolonged period of time, as we've said, we want to make sure that we don't expose you to any of the long-term side effects of these antibiotics. So some antibiotics, if you give them in too high doses for too long, can actually cause problems with hearing, for instance. So what we may have to do is keep reviewing your treatment on a regular basis, and when it's safe and appropriate to step you down to either tablets or a weaker antibiotic, as it were, we'll do that.
Okay.
But I think, as you've said, the most important thing in the first instance is to make sure this infection is treated well.
You said it's an infection, so I've caught it. I mean, where might I have caught it from? You said it's not from this chap in the office because it's not the swine flu. I mean, well, I suppose the answer is you don't know where it could have come from, do you?
I don't.
No.
But I think it does lead us on to a next step in treatment, which is not treating you as such. But given that we know you have had this infection.
Well, yeah. What about the girlfriend?
Well, exactly. I think what we need to do is start thinking about close friends and contacts.
Yeah.
Because whilst it's unlikely, there is a small chance that they may.
Yeah, or parents actually. Yes, I suppose. Well, people in the office for that matter. They work.
Absolutely.
So I suppose we're in lots of contact with people. Do you need a list or something, or?
Well, I think what we need to do is try and start developing a list, like you said, of people that you're in contact with, and defining how close that contact is and how regular. Now, I think that's a little bit beyond the scope of our conversation today.
Yes.
But there are a number of people that can help us with that.
Right.
One body in the UK is the Health Protection Agency.
Right.
And when some people get infections such as this, where we've got to think about not just treating you, but trying to prevent other people catching it, we are required to notify them that you've been unwell with this disease.
Right. Oh, I see.
Now, is that something you're happy with me doing?
Yes, because I don't want anybody else to catch anything at all, and yes, that's quite fine.
Okay, thank you very much. So what we'll do is, after we've spoken, I'll get in touch with them, and they can then start the process of making sure all of your close colleagues and contacts are treated with some antibiotics to prevent any infection developing.
Okay.
So just to recap, we've talked about the diagnosis, which is meningitis, this infection.
Yeah.
The treatment, which is going to be antibiotics.
Yes.
And reviewing all your friends and family.
Right.
In terms of the next thing to ask, it's probably prognosis. And I expect you, first and foremost, to make a full recovery from this. You're doing very well at the moment.
Right, good.
And I see no reason that should not continue.
And once it's cleared, I mean, it's not something that will come back again. It's not sort of got into the system in any way and might suddenly flare up again.
No, there's nothing to say you couldn't catch something again in future.
No.
But I think what we'll do is review your immunisation state afterwards and make sure we've done everything we can to reduce that.
Yeah.
In terms of other long-term results of meningitis, I think your chance of developing side effects like we may see, you mentioned children who can sometimes be more unwell with this.
Yes, yeah, sure.
I think your chance of developing any serious long-term side effects is minimal.
Right.
Is this something you'd like to discuss, or given that it's really unlikely, would you like to leave that for another day?
Yes, I think so, because we just have to wait and see what happens. I mean, the good news is obviously that I'm going to get better from it, and as I say, I'm quite happy with whatever treatments you recommend.
Okay.
And if there are any side effects, well, too bad. I'll have to live with those. It's going to be worth it in the end, isn't it? So
I think the first concern is
I hope the
getting
hearing
better.
isn't affected, but I mean, again, if that happens, then that's probably the lesser of the two evils. I mean, supposing it wasn't treated, I mean...
Oh, potentially then this could be a fatal illness.
Well...
So the number one
no
priority
argument, is there?
Absolutely not. We
No.
need to treat it.
Yeah.
And with regards to your hearing, please, and obviously I don't want to concern you, but let us worry about that. We'll perform some hearing tests.
No, it probably
now we've
won't
started
happen.
you on
Probably
treatment.
won't happen.
No, but we'll do hearing tests
Yeah,
and
yeah.
we'll look at the levels of the drug in your blood
Sure.
to make sure this is not a problem.
Yeah.
Okay.
Right.
Is there anything else I can answer for you, or anything you'd like me to recap, given how much?
No,
we
I don't think
discussed?
so. I think it's. I think that was all very, very clear. I mean, the main thing is that, as I say, meningitis really did sound bad when the GP suggested it, and I was hoping that, oh no, let's hope it isn't that. But now you've explained it, it does seem that, it's potentially serious, but in fact, like you said, you seem to have caught it early and hopefully get a full recovery out of it. So that's fine,
That's what we're aiming for.
quite happy
George.
about that.
Okay.
Yeah.
Well, thank you very much.
Right.
Any questions, we're always around.
Okay, sure.
But
Yeah.
otherwise, thanks for your time, sir.
Right. Thank you.
Cheers.
Thank you.
Thank you very much, Dr. Ritchie. Again, would you like to just summarise the salient points of the conversation you've just had?
Okay. So in that consultation with George Wass, the key piece of information to convey was that he was being treated for meningitis in hospital. He had a concern that he may have swine flu due to a contact. However, investigations have made it very clear the diagnosis was meningitis and that he was to be treated for that. We discussed the treatment, which was antibiotic therapy, the need for contact tracing and prophylactic therapy, and we touched on potential long-term complications, including hearing loss, and we sort of left it at that, really.
Mm-hmm. So what are the other complications we might expect from meningococcal meningitis?
I think the course of disease can be fairly complex. For a man who's presented and has been treated before he's developed any neurological symptoms, I think the risk of long-term side effects is very low.
Mm-hmm.
For someone who's presented with full-blown meningococcal septicemia, has neurological complications such as decreased level of consciousness, evidence of seizures, then there may be long-term consequences in terms of seizure risk, for one. However, in this gentleman, I think his risk of long-term complications is minimal.
Okay. Did we have any idea of how he's actually come to contract this?
No. He mentioned on several occasions a colleague who'd had swine flu.
Yeah.
I guess this is something that we could have covered in more detail insofar as what was that patient's degree of symptoms. So that may potentially be a misdiagnosis. And again, perhaps I could have explored in more detail any potential contacts who had meningeal symptoms.
Okay. Now, he was quite happy for you to talk to the Health Protection Agency about him and to sort of start the contact tracing. What if he'd said no? What if he'd refused?
I think that would be a challenging situation. This is a notifiable condition, so we would have an obligation to discuss this with the Health Protection Agency. I think if he had requested that we do not, we would have needed to spend quite some time exploring why he didn't want us to do that and ensure that he understood the rationale behind protecting the public, and also trying to find out if there was anything he was concerned about in terms of colleagues or co-workers that was forcing him into making that decision. If after a thorough discussion he still requested that we do not,
Yeah.
then I think at that point it would be appropriate to escalate the discussion and involve one of my senior colleagues, a consultant. And beyond that, then I think you may have an obligation to break confidentiality. Obviously, you'd have to warn the patient of this. It should be done by a senior clinician, and it would be appropriate to speak to a defence agency or the trust lawyers before doing so to ensure that it was done in an appropriate manner.
Okay, good. Now we covered quite a lot in a short space of time. We actually had another 2 minutes to go there. Just tell me how you tackle that. In the exam scenario, you've got another 2 minutes with the patient. What are you going to do with that time?
I think in that point it's sensible to recap the discussion, ensure that they have a full understanding, ask if they have any follow-on questions, and perhaps use the time to plan the next step. So we've established what the treatment's going to be, and we could plan a further meeting to either assess his prognosis or give him more information regarding his hearing tests or subsequent investigation.
How are you going to practically assess his understanding of what you've told him?
You can ask him to repeat things back to you, surmise the discussion, or you can ask him a direct question about any of the points that you've raised.
Okay. Thank you very much, Dr. Ritchie.
Thank you.
I thought your the scenario went very well. I like that you ask him how he wants to be addressed. I think that's an important, and on the whole, conversation was jargon free, and I think you covered a lot in a short space of time. Very thorough, reassuring, but still impressing the importance of treatment. Covered screening and the Health Protection Agency. I would just say it's important to read the scenario. I think at one point he said he was going to be started on antibiotics, but the scenario quite clearly says he's already on IV antibiotics. And he did ask you a question which I thought you dodged a little bit. So is it better or worse in meningitis as a child or as a 30-year-old man?
I think it's worse as a child. But I do think the key issue is time to treatment.
Yeah.
Because if you're a child and you're treated promptly, you'll probably have a better outcome than an adult who is treated late. I think it's probably fair to say I dodged that slightly. I would argue that I moved the discussion onto my own terms.
Okay, thank you. So this scenario is clearly about transferring information to the patient. The information you've given is quite limited. When you're faced with this in the exam, I'd expect the patient to have lots of questions. And even though in this case Dr. Ritchie finished the scenario quite quickly, I'd expect that if you were to ask the subject if they had any questions, there probably would be. And there's an opportunity to then reflect and summarise what you've said so far. The key legal points here are it is a notifiable disease. The patient doesn't have any right to refuse you to get in touch with the Health Protection Agency, it's good to have in mind. This is a good example of what you might do if the scenario finishes early and how you might fill in that extra time.